Están escuchando Nuestra Gente con Linda Parra. You're listening to Nuestra Gente with Linda Parra.
To improve quality health outcomes here. And in addition to that particular agreement that was signed by the state of Ohio and the federal government, Medicare and Medicaid dollars are coming in here to meet the patient need. We're here because we live at a moment of extraordinary opportunity for medical care and research. In the year of 2022, over $81.5 million was passed at the federal level in order to assist all kinds of medical care and treatment. It was because of the pandemic, but those dollars are now being spent, and I want a lot of them to come right here to Northwest Ohio.
The budget that we have presented to the General Assembly is money for a historic long-term study in behavioral health. And Bowling Green State University and University of Toledo would be directly involved in carrying out a portion of that study. One of the things that our big picture that we're trying to do in Ohio is really, you have to go back 60 years when John Kennedy signed the Community Mental Health Act. And the commitment was made that we are going to have good community care for people with mental health challenges. Everywhere, no matter where you live across this country. We've never been able to really achieve that. We've taken this on the last several years. Director Lori Criss is my point person on that. I want her to comment on that, particularly in regard to how it pertains to the medical center.
We toured the Behavioral Health Center here, which serves adolescents and youth and older adults, so people under the age of 18 and people over the age of 55. I was excited to learn that with some planned expansion, and I'll certainly be happy to turn it to you if you want to answer any detailed questions, that the expansion will include additional capacity for children and youth in the community who need inpatient care but who need outpatient services as well. Anybody living with and recovering from mental illness and a substance use disorder wants the same thing that all of us want, to be at home with family, friends, in school, working, and engaged in the community. And so the expansion will allow for that. It will also allow for outpatient services for older adults and for inpatient services for adults with serious mental illness. And that's something that's not happening at UTMC right now, so that expansion is vital.
I had a question. How do we increase the numbers of bilingual professionals in the medical field? Latino population is growing in the U.S. and we had a really low number, a very low number of bilingual professionals in the medical field to treat those Latinos that have mental health issues and other issues.
So as part of our workforce initiatives, we are at the tail end of creating a behavioral health workforce roadmap, and that included input from people with lived experience, family members, health professionals, employers, and others. And cultural and linguistic competency is one of those key pillars of the work that we're doing. We need to make sure that we have a diverse workforce that understands the cultural needs of the people being served and can meet those needs both in language and in other aspects of wellness and recovery. So it will have a piece that is dedicated to recruiting a diverse workforce that is able to speak multiple languages as well.
Thank you all very much.
For this facility, or what might come next after this tour in terms of that expansion?
Well, as far as the mental health is concerned, there's a tremendous shortage of all levels of behavioral care in the United States and certainly in this community. We do not have an adult inpatient behavioral health unit at this point, and so the plan is to construct one. We have a design and our plan is to create an inpatient psychiatric unit in this hospital. I think it ties together the fact that we already offer the pediatric psychiatric services, the geriatric psychiatric services, so we'll have the full spectrum. And it's also an opportunity, obviously, for our trainees, our residents in the Department of Psychiatry and other fields that rotate through. So it's great for education, it's great for research, and the community certainly needs the care.
Are you guys in talks of using, getting federal dollars or state dollars for that, or more for that?
All possibilities are on the table. We're looking at a lot of different ways to fund this, including through donor support. There are a variety of mechanisms needed to fund this.
Today, a very important part of our mission in behavioral health and mental health is the workforce. Actually, people who can be encouraged and incented to be a part of caring for individuals across the state. Actually, Director Criss knows more about this than I do, but we've been partnered on this. The governor led a request last year, approved by the General Assembly, and those funds are now, this isn't just a promise or a talking point, these are dollars that will be going to colleges and universities throughout the state to help build the behavioral health workforce. $45 million this year and some additional dollars, another $40 million for other assistance to build the behavioral health workforce in this state. So thank you, Governor, for your leadership on that. In fact, these dollars will be coming fairly soon to places like the University of Toledo and others. And we just think it's an important additional component, not just about facilities, but about actual workers, caring individuals who are willing to go into these important behavioral health and mental health fields to serve individuals.
Hospital, state-owned hospital. Now that you've toured it, how important do you think it was that the state held on to it?
We're talking about here,
Yeah,
the medical center.
the UTMC.
No,
Yeah.
look, this is very, very important. Quality of life. One of the main things for quality of life is how good the hospitals are, and whether people have access to the hospitals in their community. So this hospital not only continuing, this hospital growing is vitally important, not just to Toledo, not just to the people of Lucas County. It's vitally important to all of Northwest Ohio.
Historically, the Latino population at the University of Toledo has been very small, and so recruiting from this area has really not yielded much in terms of the ability to grow that population. So what we're doing currently is we're working with international recruiters, agents in other countries, particularly Spanish-speaking countries, to recruit students to the University of Toledo. We're currently working with one company that has a strong focus in South America. We're interested in other areas as well where there are bilingual individuals who we could convince to move here for our quality training program.
Throughout the hospital and the clinics, we have translation and language services, not just for Spanish speakers, but also for a wide variety of other languages. So if a patient comes to UTMC and they need care but they don't speak English, we can find a way to make sure they're cared for and they understand what's going on with their care.
Well, we know that medical outcomes are better when we have a more diverse healthcare population, professionals, caretakers, doctors, nurses, allied healthcare field. We know that the outcomes are better when we have a diverse population serving in these fields. And I think it's true of education generally. We don't have enough educators who come from diverse enough backgrounds to help lead. Same thing in the medical field and medical education. So I think that's very important. It's challenging. We've had continual declines, even just the numbers of overall nursing educators in the last number of years in the state and the country. So all of these things are really important, and we have to be diligent to be a part of that solution.